I'm Kelsey Boss, Doctor of Physical Therapy and one of Compleo's Scoliosis Certified Therapist. So if you've been recently diagnosed with scoliosis, you might have heard the words Schroth, scoliosis-specific exercises discussed. And this is what we do to address scoliosis. It is an evidence-based treatment method. So how is it different than traditional core strengthening exercises or back pain exercises? There's a lot of things that are unique about how we treat scoliosis. One of those is addressing scoliosis in all three dimensions. So if you have a curve, you need to think about your C or your S curve. This is what doctors are typically going to tell you. You know, you have a 20-degree curve or a 15-degree curve or higher. That's how much you curve side to side. But with scoliosis, our back also rotates at different points. So if you're thinking about this as your upper spine and neck, your thoracic or mid spine, lumbar, low spine, and pelvis, they all rotate different ways based on your curve type. Then the third thing that changes in your back is if you're looking at someone from the side, we all should have a little bit of an arch in our low back and a rounding in our upper back this way. This is called kyphosis and lordosis. With scoliosis, this can become increased to where you have a really big rounding, or it can become decreased to where you have a pretty flat back. Both of those changes can affect our posture, our pain, and our breathing. So it's really important that we don't just address that curve degree that the doctors told you about, but more importantly, all three dimensions together for your best possible outcome. Our goals in Schroth and in scoliosis therapy are for pain prevention if you don't have pain yet, and if you already have pain reduction, postural improvement, respiration and breathing improvements. A lot of times scoliosis changes where and how we breathe in our rib cage. And then of course also curve improvement if you're continued growing. We don't want that curve to progress, and ideally we would want that curve to decrease as you continue to grow. What we do in Schroth is we're going to analyze your x-rays and come up with a plan that is just specifically for you. Then we're going to use lots of different tools like these wedges. We have scoliosis bars in the clinic to treat you first laying down so that you can learn how to hold an improved alignment, breathing, and posture in a against gravity position, and then we work towards harder sitting and standing position so that in your day-to-day life you can hold those changes in your back. There's a big neuromotor retraining component in how you hold your posture, how you hold yourself throughout the day. This is not instead of a brace if your doctor has recommended a brace. If your curve is 25 degrees or more, and there's actually studies out there to show that Schroth and bracing together is more effective than the brace alone or the exercises alone. So we are looking to be a part of your scoliosis treatment program. We are not looking to replace your orthopedist recommendations, replace your brace. This is supposed to be all working together for your best possible outcome. There is a commitment from the patient for this to really work. The client is expected to work on their exercises about 20 minutes a day. So in clinic, we are going to take pictures of everything that you do, give you a binder of your exercises so that you have a toolbox on how to manage your scoliosis posture and any pain and breathing impairments for the rest of your life to take with you. We find out what sports you like to play. If you work at a desk, if you're in school, we then work on applying that posture to those functional activities. So we're really improving your day-to-day life, and you're really carrying this through with you throughout the day and throughout your life. So Schroth is very different than normal physical therapy. You might have a lot of questions about it. We would love to talk more about it on this page. We also have linked the most up-to-date research for scoliosis specific exercises in the past 5 years. And if you have any questions at all or are ready for your free discovery visit, just give us a text or a call.